Hello, my name is Frances Angela C. Egot, your student nurse for today. I will be performing the return demonstration on the application of cold and hot compresses. Cold compress is indicated for acute injuries, pain, swelling, inflammation, and bleeding because it causes vasoconstriction, which reduces pain and edema. Hot compress is indicated for chronic pain, muscle spasms, and muscle stiffness, and to improve circulation because it causes vasodilation, which promotes muscle relaxation um, and promote blood flow. Alright, good morning, ma'am. My name is Frances Angela C. Egot, your student nurse for today. May I ask for your full name, please? Your birthday? Can I check your ID band for verification, please? Okay, so first, check the doctor's order regarding the type of compress, location, duration, and the desired temperature. I will also check the patient's chart for any contraindications to ensure that the procedure is appropriate and safe. Alright. Cold compress is contraindicated in patients with cold hypersensitivity, and hot compress is contraindicated in patients with active bleeding and acute inflammation. Alright, I will assess your affected area for skin color, odor, size, tenderness, drainage, and the temperature sensitivity. May I please check it? I will only expose the affected area for your privacy. Does it hurt when I touch this area? Alright. Alright. Now, have you ever had a cold or hot compress before? Do you understand the procedure? Okay, do you have any questions? Alright. Now ensure that the patient's vital signs are assessed and the mobility are assessed before proceeding. And the expected outcomes for this procedure is reduced pain and swelling with a cold compress, and improve circulation and muscle relaxation with a hot compress. Alright, now I will prepare the materials and the equipment to save time and energy. And then today I will be demonstrating both hot and cold compresses. You will feel warm or cold during the procedure. Please inform me immediately if you feel or experience any severe pain, discomfort, and numbness and burning. Is that alright with you? Alright. Now I will close the curtains around your bed for your privacy, and I will assist you in a comfortable position. And then I will perform hand hygiene to prevent the spread of microorganisms. Then I will place this waterproof pad under your affected area to keep the bed dry. And then I will apply the cold compress. This ice covered with a towel, and place it gently over your affected area. And then the cold application lasts for 15 to 20 minutes. Reapply the cold compress if necessary, to maintain the cold temperature. And reassess. I will regularly reassess your skin condition to prevent any tissue injury. If I observe any adverse effects or any unusual reactions, and if you experience any severe pain and discomfort, I will stop the application immediately. Alright? Next, I will demonstrate the hot compress. I will use this towel to moisten with a warm water. Wring the excess water and place it gently on your affected area. The hot compress is also usually lasts long for also 15 to 20 minutes. And reapply the warm water if necessary, to maintain the warm temperature. and reassess the patient's regularly the skin condition to prevent any burning and tissue injury. And then if you observe any adverse effects or unusual reactions, and if the patient experiences any extreme pain or discomfort, stop the application immediately. Alright, now that I am done with the application, I will remove my gloves and dispose of them properly. Perform hand hygiene to prevent the spread of microorganisms. Then I will return you into a comfortable position. Alright. And then I will remove, clean, and dry and dispose of the equipment used properly. And then I will ensure that I will inspect or assess the affected area again to check if the compress is effective. Alright. And then on a scale of 1 to 10, with 1 being the least comfortable and 10 being the most comfortable, how would you rate your comfort? Okay. And then do you not feel any pain, numbness, discomfort, or any burning? Alright. And now you ensure that the patient's vital signs and mobility are assessed and compare it with the findings or the data that we gathered before the procedure. And then there are no unexpected outcomes noted after the procedure. And now I will document the procedure and the patient's reactions and my findings in their chart and report them to the doctor. And thank you for your cooperation.